So thank you everyone for joining us today. My name is Lori Marie Peixoto, and I'm the Education and Outreach Coordinator at NeedyMeds. NeedyMeds is a national nonprofit organization, and we aim to connect patients with programs all over the country that will help you pay for your healthcare expenses, including medications. Today we have a very special presentation. It's called Putting PrEP into Action, Getting Prepared. And we have a special guest presenter, Joey Wynn, who I will introduce in just a moment. Before we begin, I just wanted to touch on a few housekeeping points. Everyone will remain on mute for the duration of this presentation. Should you have a question at any time, you can simply type it into the questions bar in your control panel. Joey and I will answer questions at the end. This webinar will be recorded and placed on NeedyMeds webinar library page. So you can watch it again, or you can share it with friends or family members. It will also be on our YouTube channel, and that will probably happen later this week, hopefully at the latest, or maybe in the week that follows. And lastly, I will provide my contact information at the end if you need any further information, or if you would like a PDF of Joey's presentation. I'd be happy to send that to you. So let's begin. According to the Centers for Disease Control, about 50,000 new cases of HIV are diagnosed every year. So in honor of World AIDS Day, we have a special guest, Joey Wynn, and he will be presenting a presentation to teach you about pre-exposure prophylaxis, or what we call PrEP, and what it is and if it's right for you. Joey Wynn is chairman of the South Florida AIDS Network, and he has a very impressive resume, so we're delighted to have him with us today. He is also co-chair of the Florida HIV/AIDS Advocacy Network. He also works as the Community Relations Director for Empower You, which is Miami-Dade's newest federally qualified health center. And in addition to that, Joey has served on the Florida ADAP, or AIDS Drug Assistance Program work group, and he's been serving for more than 7 years on their board of directors for the National ADAP Advocacy Association, which is based in Washington, D.C. Joey has extensive experience training case managers, social workers, and other health professionals. So we're really honored to have him with us today. Before we begin, though, we have a very brief poll that we would ask you to take. The question is, how familiar with PrEP are you? If you've never heard of it today, we'd like to know. If you have heard of it, but you're not quite sure exactly what it is, you can check that box. If you understand the basics, we'd like to know that as well. And even if you are very knowledgeable about PrEP, we hope you'll still have something to learn today, so check that box as well. And I'll give you another 10 seconds to vote. Okay, and another 5 seconds, I will close the poll. Okay, so here are the results. 57% have never heard of PrEP until today. 14% have heard of it, but are not exactly sure what it is. 14% understand the basics of PrEP, and 14% are very knowledgeable. Well, welcome to everyone. We're delighted to have you here. Without further ado, I'd like to make Joey, to pass the mic to Joey, so give me one moment to do that, please. Okay. So just bear with us for a few seconds as the system there we go. So Joey, we can see your screen now. And welcome again, Joey. Thank you so much for joining us today.
Okay, great. Thank you, Laura. Can you hear me okay?
Yes, sir.
Wonderful. All right, thank you, everybody. I'm actually pleasantly surprised that we have 57% that have never heard of PrEP before today. So I will try and slow down, explain my acronyms and my jargon, and try and keep this at a basic level for most of the concepts. And hopefully for the other folks on the webinar, we will cover some things that you might not have known. But most importantly, I've given some resources and information to Lori to send out to folks afterwards that can give you some research and some information and some guidance to follow up on, with some websites, some materials, and some items to follow if this is something that you're interested in beginning to implement in your local areas. So what is PrEP? Let's get prepared. That is a theme that we've used in Florida to disseminate some local town hall programs and some community conversations about PrEP. Uh-oh. All right, let's see. Maybe if I just click it there. Okay. To give you some background on where I am with this, I was at a meeting about 2 years ago where Dr. Jonathan Merman showed some really startling slides at the International AIDS Conference back in 2012 in Washington, D.C. And it really struck me, one particular slide where if current trends continue, half of today's young black MSM will have HIV by the age of 35. And if that wasn't troubling news enough, it also, for all gay and bisexual men and other men that have sex with men, over half will have HIV by age 50 if the trends that we currently are experiencing remain constant. That is a very disheartening statistic to look at, and that was when I thought prevention needs to take a higher priority in what I do in terms of public policy and community education. Flash forward 2 years, in September of this year, Dr. McRae from the CDC put out some information just before National Gay Men's HIV/AIDS Awareness Day and talked about the reprioritization at CDC, where gay and bisexual men of all races continue to be the group most severely affected by HIV. This context, let me first say that PrEP can work for heterosexuals as well as intravenous drug users. The context that I've been working in has been for gay and bisexual men and other men that have sex with men, but these issues apply to anybody that is accessing the healthcare system. But what struck me was the CDC has prioritized this group based on some of the alarming trends and statistics that have come out. And they have come up with a roadmap where they're going to increase their focus on local testing initiatives, identifying and re-engaging people that already know they're HIV positive, who have fallen out of care and have not seen a doctor in the past year, and get them to get back in care, get access, and stay on treatment for HIV. Also funding community-based organizations to provide peer-to-peer support with evidence-based interventions. The CDC used to fund a lot of those. And launching a national awareness campaign, including Start Talking, Stop HIV. There are a bunch of different awareness campaigns that you can Google and investigate and find out how you can be a part of those campaigns. They've shifted many of their core programs to prioritize early diagnosis, finding out if people are positive or not, linkage to and retention and care. So that was where I found the information about PrEP and some of the ways that it can be done. So the goals of the presentation, to let you know about the CDC guidelines for the administration of PrEP in a clinical perspective, possible resources for you to research for the programmatic implementation of current PrEP method. I got a couple of agencies that already have things up and running across the United States, so we've got materials about that. Then talk about some of the stuff that drives the controversy on the national debate about current adherence challenges and other barriers and concerns on both sides. And then details on what a local PrEP program should be doing and how they help in the overall strategy of lowering HIV infections in the community. Where did I go? All right. So PrEP is pre-exposure prophylaxis. That's an HIV-negative person taking medication to prevent the infection with HIV. You'll hear people talk about PrEP, which is very different. It's post-exposure prophylaxis for people that had a needle stick or an accidental, what they think they might get infected. And then TASP, which is treatment as prevention. There were clinical trials that show that people that are HIV positive that are on HIV medication and their viral loads are controlled and undetectable are 96% less likely to infect someone else. So by known HIV positive people being in care, on therapy, and undetectable, it reduces dramatically the likelihood of infections occurring. So that's a different kind of prevention, but a very powerful one nonetheless. So you might hear prevention folks talk about a toolbox. So I looked around and I found a slide that shows you all the different kinds of tools that are in the toolbox. The vaccine, we do not yet have an effective vaccine. We have harm reduction, PrEP, microbicides, circumcision, particularly in third world countries, sexually transmitted infection treatment, because people with active STIs are more likely to get HIV. We have condoms, we have education, mother-to-child transmission interruption, where the mother has HIV medication therapy before and during delivery to prevent the newborn baby from getting infected, and treatment as prevention, drug and alcohol treatment programs to help people lower their risky activities. So you got a whole bunch of different things that help reduce the likelihood of HIV infection in a given community. That's what they talk about when they're talking about the arsenal or the toolbox. So in a nutshell, because it can get super complicated, and I recommend that you go to CDC's website and download information for healthcare providers and for people that want to investigate if PrEP is right for them. But this is, in a nutshell, a very simplified version of it. Before initiating PrEP, you have to determine if somebody's eligible, if they're high risk, including their current HIV status. You must know and have an HIV test that says you're negative for PrEP to work, because if you're HIV positive, PrEP is not the right thing for you to be doing. And to begin your PrEP regimen, you got to talk about dosing and adherence support and how you're going to be able to be successful, and we'll go into detail on that later. And then follow up while on PrEP medication is being taken. You've got to go back to the doctor every 3 months. You've got to monitor for HIV tests, sexually transmitted infections, talk about risk behaviors and adherence and safety. And then, of course, if something goes wrong, you have to discontinue PrEP. There are 3 primary reasons. Patient choice, they no longer want to take it. Safety concerns, if they're having issues or side effects, or if someone has become HIV infected. So we will go into more detail at this point. What are the factors to help identify individuals at high risk? If they have a partner, a main partner, or someone that they have sex with on a regular basis, and that person is already known to be HIV infected, that makes somebody at high risk. Other ways are engaging in sexual activities in a high prevalence area like most of the big urban cities. If your social network includes people that are HIV positive, and one or more of the following. If people report they're not using condoms at all, or they don't use them consistently or infrequently, if somebody's been diagnosed with a sexually transmitted infection, if there's an exchange of sex for commodities such as money, food, shelter, or drugs, if there's a use of illicit drugs or alcohol dependence, if somebody's been previously incarcerated, partners of unknown HIV status with any of the factors listed above. So if they don't know they're negative, those unknown status folks also put somebody at a high risk. So these are people that would be considered at high risk for contracting HIV and are the most likely candidates to benefit from PrEP. When prescribing TRUVADA for PrEP indication, healthcare providers have a list of things that they need to check off. And again, whether you go to the CDC site or you go to the PrEP websites that tell you about things, they've got some really handy checklists and forms that you can use to make sure you've covered all your bases and you've got all the information you need and you've covered all the topics when you're talking to your healthcare provider. Prescribing TRUVADA is a part of a comprehensive prevention strategy because the drug itself is not always effective in preventing the HIV infection from occurring. Counsel all uninfected individuals to strictly adhere to the recommended daily dosing because you need to be taking it every day, missing the fewest doses possible. The drug does have some forgiveness in terms of you can miss a dose here or there without it significantly impacting the ability to protect someone, but it's very strongly encouraged that people take it every day, 7 days a week, without missing a dose. But there are some clinical trials that say people that didn't take it every day still had some level of protection. You have to confirm a negative test before initiating TRUVADA, because people need to make sure that they're HIV negative before starting it, and a provider would be able to do an HIV test in the office if they need to. You need to delay starting PrEP for at least 1 month and reconfirming HIV status. So the first step is getting a test. The second step is 30 days later coming back and reconfirming you're still HIV negative to be able to start it. You have to use an FDA-approved test. While using TRUVADA, screening tests should be repeated at least every 3 months. So the providers should be aware of those things in terms of what needs to be done for people to be able to start this program. TRUVADA use for PrEP indication is only prescribed to individuals confirmed to be negative. Do not use TRUVADA for PrEP indication if signs or symptoms of acute HIV infection are present or a negative infection status isn't yet confirmed. Lactic acidosis and severe hepatomegaly with steatosis, including fatal cases, have been reported with the use of one of the drugs in this component variant. This particular TRUVADA has 2 different drugs in it. And so when you talk about TRUVADA, that is the brand name of something that's got 2 different drugs in it. Why use this particular drug? It was FDA approved to do so. I believe it's the only combination so far that has been approved by the FDA to do something like this. Because TRUVADA is not always effective in preventing the acquisition of HIV, TRUVADA is used in combination with a comprehensive prevention strategy. Includes safer sex practices such as regular and correct condom use. I have to re-emphasize regular and correct condom use, regular HIV testing, and other proven HIV prevention methods for those people that have syringe programs in their states where it's legal. That's indicated for people that are injection drug users. There are a number of other harm reduction and prevention strategies people should continue to use. TRUVADA must only be prescribed to uninfected individuals at high risk who are confirmed to be negative. I can't reaffirm that enough, is that you've got to know that you're HIV negative before you start doing this. And uninfected individuals who are prescribed TRUVADA for a PrEP indication should not miss any doses. Missing doses may increase the risk of acquiring HIV. Some of this stuff is taken directly from CDC and the box label warnings from the drug itself. So I'm trying to give you all the balanced information. Prescribe TRUVADA for PrEP only as part of a comprehensive prevention strategy that includes other prevention measures, like I said before. It's not always effective, although if people take it correctly, there have been some clinical trials that show people were able to avoid HIV infection as much as 96%, 92 to 96%, depending on the clinical trial. So it's highly effective if taken as directed. You have to inform uninfected individuals about and support their efforts in reducing sexual risk behavior and have that conversation with people so they can understand what sexual risk is, especially if they're in a known area where HIV prevalence is extremely high. Again, this is kind of reiterating what I've already talked about. I'll skip a little bit of this. We do suggest people counsel uninfected individuals to strictly adhere. It's really critical that people learn a strategy and they're able to figure out a way to make sure they take a dose every day and they try not to forget and try not to miss doses. That's important. A couple of other safety information warnings. These drugs in other situations have been known to decrease bone mineral density. I believe they're doing some clinical trials to assess that now with HIV-negative individuals. The drugs also have to communicate that there was observations about patients receiving antiretroviral therapy had redistribution or accumulation of body fat. And then there's the hepatitis B infection. It's recommended that all individuals be tested for the presence of hepatitis B virus before initiating TRUVADA. And again, providers are aware of these kinds of situations and have those conversations with people up front before anybody starts any kind of therapy. HPV uninfected individuals should be offered a vaccination. Pregnancy. TRUVADA has been evaluated in a limited number of women who are pregnant. Physicians should assess the risk-benefit when considering this with women. The data suggests there's a potential increased risk of HIV infection during pregnancy. If an uninfected individual becomes pregnant while taking TRUVADA, careful consideration should be given to whether the use of TRUVADA should be continued. And there is a pregnancy registry available. Again, the providers that have been trained in this are very aware of this stuff. It was just something that people oftentimes aren't aware of. Nursing mothers should not breastfeed while taking this medication. The components of TRUVADA are excreted in breast milk, and it's not known that this could harm the infant. And for pediatrics, children under the age of 13, TRUVADA is based on a trial in adults, so there's no data about pediatrics at this point. Some of this is just reiteration and saying things. This is a little more important. Co-administration with other products. Some people find out about TRUVADA and don't have access to TRUVADA and think, well, I know other drugs that have it. But you really should not use TRUVADA, especially with other drugs that contain the individual components of TRUVADA, which are emtricitabine and tenofovir. Do not administer in combination with Hepcera, which is another name for tenofovir. For further details about TRUVADA drug interactions, see the prescribing information. You get that with every box, and you can talk to your prescribers, whether they're doctors, nurse practitioners, physician's assistants. You can ask for more information from your pharmacists or pharm techs. Common adverse events in HIV unaffected individuals in PrEP trials, adverse reactions that were reported by more than 2% of people more frequently than placebo, were headache, abdominal pain, and weight decrease. So there were some people that did experience some side effects. As with any medication, there will always be some people that are more likely to experience side effects from a drug, and it's a very individualized situation, so no one expectation for what's going to happen. There are some other forms that are really useful. I had pictures up here, but they were too small, so there's an agreement form to start TRUVADA for PrEP, and there's a checklist for prescribers that are on the TRUVADA.com websites that are really simple and easy, and you can download them and print them out. Those are pretty useful tools for people to make sure they have a detailed, comprehensive conversation about what are the pros and cons, what do we need to do to start it, what's involved with it. And that information's already been created and provided by the manufacturer of TRUVADA, so that's available. I oftentimes get a lot of people asking me, well, which websites are the best to go to? If you're on Twitter, the hashtag PrEPWorks is pretty good. You see some great conversations, pro and con, going back and forth on those at any given time. My favorite one is the myprepexperience.blogspot.org. That one's got some really useful tips and tricks and spreadsheets and best practices from folks. And then, of course, the traditional formal cdc.gov website that's got all the information you need for people considering PrEP. So there are a number of different things. You can simply Google PrEP and put in your state or your city and see what's out there. There are a lot of things out there now for people to be able to research. So, why is it? I'm just going to go ahead and put it all out there. There are people that are for this and against this, and I think it all stems from a daily medication. Human beings are pretty bad at taking medicine consistently and regularly, and I think that's the greatest point of friction between national advocates. People aren't going to take it right, so we shouldn't do it, and the people that say it should be available for people if it's appropriate and they're adults, they should be able to have access to it. So that's where the friction kind of comes from. My personal belief is that the focus should be on treatment preparedness. Readiness to take medicine and have a successful strategy that works with your lifestyle and your living situation is critical to increase the likelihood of success. It can be done for people in a variety of different lifestyles and living situations. The issue is being aware of it, having conversations, and have people figure out what that strategy looks like before they start is a really great way for people to have a plan and be successful. Long-term adherence is difficult for anybody, for any drug, so you have to have a certain level of discipline, and there's got to be structure in order to miss as few doses as possible. Some people do experience side effects. There are mental health issues that some people do experience. There are overall costs with copays, deductibles, and premiums, the whole argument with managed care and insurance plans and all the difficulties that come with that. Healthcare access in general for a lot of people at high risk that do not currently have access to healthcare or never have. And then people need a resource to help get through all these temporary barriers. There's a lot of different solutions depending on where you live, how you're covered or not, who's working on your behalf, whether you have a peer or a case manager or a social worker. Those things greatly impact the ability to be successful to do something like this. And then there are individual barriers like drug or alcohol use, problems at work or in personal relationships, readiness, relapse, needing to be a part of a comprehensive program that has a focus on the entire person, not just the HIV, is critical for it to be successful. You've got to make this fit in somebody's lifestyle, whatever that may be. So you've got to really figure out some strategies on how to get it, how to store it, how to take it daily, how to get access to that healthcare provider on a regular basis. And then the system-related barriers, insurance coverage, copays, stigmatization some people face when they want to get an HIV medication, but they're HIV negative. And so there are a bunch of issues that surround that. And just to let you know, I've scanned some documents to share. The first packet are programs that are actually up and running in the U.S. for PrEP. There's one in Philadelphia, there's one in Miami, there's one in Los Angeles. And then the second package is about some of the research that I follow. The Cape Town Conference Summary shows a lot of great detail in terms of who's doing cutting-edge research on this. HIV Research for Prevention and the article from The Lancet recently that talks about some considerations and issues. The French EPRGay study, I think, had some real-world applications that you can glean from it. And then the British PROUD study summary. There's probably other key data to watch depending on who you are, what part of the country you're in. There are many more excellent programs and a variety of different analysts that have come up with conclusions and themes that you can find via the internet. So you've got to Google and search and be resourceful to find out what's already out there and figure out what works for you. So to summarize, there are a few best practice models out there for you to investigate and replicate from a variety of agencies currently providing a PrEP delivery method. PrEP is a great tool for some, but not everyone. Treatment preparedness is the key. You've got to build this into somebody's personal life so that it works and it's meaningful for them. And you've got to figure out how will I achieve the goal of success of missing the fewest doses possible, getting access to the drug, finding the right doctor to work with. And then there's looking to the future. PrEP's evolving technology will change the way we do this in the years to come. Some may want to wait it out for other formulations, and some are ready for it or need it right now. So there are some potential injections coming out that might be once a month or once every 3 months or once every 6 months. That will dramatically change how this all works. But some people may be in a situation where they need it today. So we've got to share information about how this works and get information out there. And there is a plethora of data out there. I think the debate's over about the efficacy. We've seen a lot of different clinical trials that show if you take it as directed, it is highly effective. The issue and the challenge is taking it as directed in terms of getting people to make sure they take a dose every day and miss as few doses as possible. So then now the debate should be about how best to remove barriers and create a successful intervention so people can use PrEP consistently and avert HIV infections from occurring. So that pretty much wraps up my information component of this. Lori?
Thank you. Thank you so much, Joey. That was fantastic. At this time, I would just briefly show people a few resources on the NeedyMeds website. We have a prescription assistance program through our website that I just want to point out, and then we will go to questions. So let me just get the screen back. Okay. So this is the NeedyMeds homepage. You can go to the Patient Savings tab, and you can search for the brand name of the medicine that you need, or you can search for the generic name, or you can type it into this drug search box. So I will demonstrate. If I were looking for TRUVADA, we have 3 pharmaceutical patient assistance programs for TRUVADA. These programs are sponsored by pharmaceutical companies. The way we list them on this page is that the programs that provide the most financial assistance will be at the top, and programs that provide lesser financial assistance will be toward the bottom. And again, there are 3. If you have any questions or you want to apply for this program, you would call the 800 number right here, which will take you to Gilead Sciences, the people who manufacture this drug, and they'd be able to answer your questions about the application. We have an active PDF file that you can fill out online, and then you would print it out and have your prescriber sign off on the application, and then you'd mail it to the pharmaceutical company, and they'd give you a decision about whether you qualify for this program or not. Each of these programs has eligibility criteria, which you will see down here toward the bottom. And we've provided a handy-dandy federal poverty level income calculator, which is right here, because most of the requirements are based on some multiple of the federal poverty level and also insurance status. But this should give you all the information you need to apply to this program, and as I said, there are 3, so be sure to check all 3 of them out. You might also find savings for health care costs related to HIV/AIDS by going to our coupons and rebates section. You can search by, let's say, category, and scrolling down, I could click on HIV/AIDS or STDs and see a list of coupons and rebates for medicines or even supplies related to HIV/AIDS. Going back to the patient savings tab, I could also look for health care expenses by diagnosis. Again, I would go under H for HIV/AIDS. And you'll see that we have a list of companies all over the country that will help pay for healthcare expenses related to an HIV/AIDS diagnosis. We list national programs at the top, and then they are alphabetized by state after that. So hopefully that can provide some assistance for you as well. We also have camps, scholarships, and retreats based on diagnosis. It's mostly for children or children in families with someone that has a diagnosis of HIV/AIDS or any other condition. You can search by diagnosis again. We also have government programs, and we also have additional resources as well. We have a crowdfunding platform called HealFunder. If you have a huge medical bill and you need help paying for it, or if you need you're trying to save money for a procedure or surgery or something like that, you can start a campaign on HealFunder, which is similar to FundMe, Indiegogo, Kickstarter. There's a medical bill mediation service that we have on our website as well. And of course, we also have a drug discount card, which you can download from the NeedyMeds homepage over here, and you can save off the cash price of prescription medicines, over-the-counter medicines, and supplies if they're written as a prescription, and also pet prescriptions that you would fill at the pharmacy. So that's basically what NeedyMeds hopefully can give you access to if you have an HIV/AIDS diagnosis. At this time, I would like to open the floor for questions. So if you have any questions, please type them in, and I'll give you a minute to do so. Here we go. Joey, can you please talk about a little bit more about the possible side effects that one might experience if taking TRUVADA? Hello, Joey? Yes, I can hear you.
Talking about side effects is difficult because it's such an individual issue. I think None of them were greater than 2%, so for every 100 people, only 2 people would experience. The 3 most common were headaches, abdominal pain, and weight decrease. So, and there are others that the company has to track for FDA regulations. But if you go to the TRUVADA.com website, they've got the actual clinical trial formatted stuff where they show you of a certain amount of people, this is the reported side effect profile for TRUVADA, and it'll show you what the common ones were. And there were some rarer ones that one person ever in the history of the drug, you know, experienced X or Y. So it's a very individualized scenario. So it's hard to describe what, you never know if somebody's going to have no side effects or somebody's going to have several. Kind of one of those things, but it is there for people to be able to research.
Great, thank you. Here's another question for you, Joey. Can you talk a little bit about issues related to access? Do most health insurance plans cover TRUVADA?
That's, again, where it gets tricky, and it's tough on a national call because depending on a state, a particular health insurance plan may have different rules and regulations in one state versus another state. I'm not sure why it varies so much, but most plans in general do cover this for people with HIV, so you have to check the plan, the formulary. You have to have your provider call and say, we want to use this for PrEP. I know in Florida we've got quite a number of plans that with prior authorization and the approval ahead of time, they do allow for TRUVADA for PrEP. So again, it's one of those things where when you're starting to have this conversation, you've got to be organized and you've got to check the plans, check the formularies, and then check if there's a prior auth or the prescriber needs to do some kind of special letter of medical necessity. I've seen a variety of different pharmacy benefit management tools used to make sure people are doing everything they're supposed to before they get access to this drug if they're HIV negative.
Thank you. A question about, can you please give some examples of strategies that a patient might employ to stay on target with the daily dosing?
Oh, there's a couple of them. My favorite is the pillbox method. You know, I have a pillbox on my nightstand, and that way there's no question. You either took it or you didn't. And one day a week, you fill the pillbox up. You can work with case manager, social worker, nurse, pharmacy technician to help you. It's one pill in the box, so it's either there or it's not. People have a buddy system, or with the smartphone technology, you can give yourself a reminder or an email. People take it right before they brush their teeth or the last thing at night, or they take it with their favorite TV show. Different people figure out different ways for a trigger to remember, I got to take my pill.
Thank you. Thank you. One question from John came in. The question is, who generally determines program eligibility, the insurance provider, the doctor, etc.? I think John is referring to the pharmaceutical prescription assistance programs. That is, program eligibility is determined by the pharmaceutical company that manufactures each drug. And so each program will vary. There's no law that says that requires pharmaceutical companies to offer discounted or free drugs to people who are uninsured or underinsured. They do this to be good, quote, corporate citizens. So as I said, each prescription assistance program will vary based on the pharmaceutical company that manufactures that drug. So rules for TRUVADA will vary from the rules for, let's say, something like Abilify or Albuterol. Do we have any other questions at this time? Okay. Well, thank you so much, Joey. We really appreciate the time you've given us today. I will put up my contact information once more. If you would like a copy of Mr. Wynn's slides, I'd be happy to email them out to you. You can simply email Lori@needymeds.org. And I believe, Joey, you said you had some other documents as well that you'd be willing to send out. Do you want to describe the documents, and then people can ask for them if they want them?
That's correct. I had 2 scan sets. Program 1 was about different programs that are up and running in the U.S., and the second one was about clinical trial and research data, so that they were in 2 different sets. They were each about 5 or 10 pages if you print them out, so I figured I'd lump them into 2 simple categories. And I'll send those to you and the slide deck after the call.
Okay, that's terrific. So if you want a copy of Joey Wynn's slides and packets of documents, please email Lori at needymeds.org. I'd be happy to send them out to you this week. If you are looking for financial assistance for your health care costs, please call our toll-free helpline at NeedyMeds, which is 1-800-503-6897. It's Monday through Friday, 9 to 5, and that's Eastern Time. Thank you, everyone, for joining us. We really appreciate the time you've given us today. If you'd like to learn more about NeedyMeds and the resources on our website, feel free to sign up for our monthly overview webinar, which takes place on December 18th at 2 o'clock. You can register for that on our website by going to our home page and then click on the Getting Started tab and then click on Webinars, and it will take you to the registration page. So thank you again for joining us. We hope you have a wonderful day, and we wish you good health and happy holidays. Thank you so much. Bye-bye.